Hi, Kristen. Thanks for joining us at the beautiful Bethlehem Rose Garden. We were wondering, since we're here, if you could tell us a little bit about some of the exciting health initiatives that'll be happening in the summer 2024 into the fall.
Sure. So the Health Bureau is always busy delivering programs into the community, but especially during the summer, it definitely is our busy time. We have a few initiatives right now that we're working on, one being the Community Garden Initiative. So we have 3 community gardens that we plant throughout the city of Bethlehem, and we rent plots to our residents at a low cost. We also have our Bike Bethlehem program, which is our free bicycle share program that's available at the Bethlehem Area Public Library, the main branch, and then Comfort Suites as well. So residents can borrow a bike for free and enjoy our beautiful city riding throughout the town on a bike. We also have our farm stand that is going to begin in July. That runs through the fall. That farm stand's held at Payroll Plaza, right between City Hall and the Bethlehem Area Public Library, and we offer fresh produce there on a weekly basis. And then lastly, we have our mobile clinic that was just recently delivered, so we're very excited about this. We received it 3 weeks ago, and we'll be taking our mobile clinic out into the community throughout the summer months as well.
So on May 17th, you had this ribbon cutting for the mobile health clinic, and that was at a Madison Park block party with over 160 people attending. Can you tell us a little bit about the event and some of the things that the Health Bureau learned at that event with the community?
So the Better Box for Bethlehem program, that's a quality of life improvement, neighborhood level improvement program that we started last year. Madison Park, that neighborhood surrounding the park, is the first community that we're working in, but we'll be working in several neighborhoods throughout the city of Bethlehem, really just as a way to improve quality of life issues that impact health and safety in those neighborhoods. It's really a partnership between the Health Bureau, the various city departments within City Hall, community partners, and the community members themselves. The block party was a fun way to get to know the neighbors, provide some fun programming, and also hear from them as far as what are their concerns, what would they like improved in their neighborhoods. So some of the feedback we received was regarding like traffic and pedestrian safety. We also talked to community members about park improvements that they'd like to see. So we'll be working with City Hall departments and again our community partners over the next few months to make those improvements. And then of course we unveiled our mobile clinic there, and the community was very excited about the services that we can provide on our clinic as well.
Wonderful. So residents were able to go on board. They were able to see what was inside the clinic. Can you tell us about what this mobile health clinic is going to be doing, how you identified it as a need, how it was acquired, and how the Health Bureau plans to utilize it? What's the strategy?
Sure. So we were fortunate that we were able to use our COVID-19 funds to purchase this mobile clinic. It really was in response to access to care, as being a barrier. So many of our clinical services are provided at the health department, which is located in City Hall. And for some residents, it's easy to get to, but for others, it may not be easy to get there. There might be transportation barriers, or the times might not necessarily work for them. So this was really a means to bring our services from our clinics that we hold in City Hall out into the community. So we'll be able to provide preventive care services, screenings, immunizations, be able to provide all those services in this mobile clinic, take this clinic out into the community, directly into neighborhoods, so folks don't need to come to us, we can come directly to them. And we're also going to be partnering with the school district, community organizations, local colleges and universities. So be on the lookout for the mobile clinic arriving in your neighborhood throughout the summer.
So thanks for joining us, Benay. We're excited you're here too. Can you tell us a little bit about increasing some of those health equity outcomes in the community, how the Health Bureau is going to be engaging with residents through the mobile health clinic and other ways?
Yes. Well, increasing health equity and social equity is at the cornerstone of all of the Bethlehem Health Bureau programs. I mean, that is really the core of all of our initiatives. So this helps us achieve that. And I know Kristen mentioned this. We do have a lot of clinics and services that we offer in-house at the Bethlehem Health Bureau and City Hall, but transportation can be a barrier for some folks. That's a big barrier we're finding in some of our communities. Sometimes childcare, just getting children watched while you're trying to go into access services, or simply not being able to find clinics that provide services in the hours where you're not working. So with this van, as Kristen mentioned, we can go right in the community and help alleviate some of those difficulties. And so that's a huge part of what we'll be doing with this. Our services we can also increase. For example, we just got a grant to increase our women's health programs. It's very exciting. So we can take our clinic, this mobile clinic, into communities. Women can get access to annual pap smears. We have family planning and contraceptive choice clinics. We have STD testing and treatment clinics, immunization clinics. We have our Community Connections program, which will be having Get to get connected clinics. So that means we're going to go into communities and help people get connected to health insurance if they're not connected to health insurance, to get connected to other social programs in Bethlehem, of which there are many. Maybe they're having difficulty accessing some of those services. We can help them get connected. We collaborate with a huge group of wonderful programs in the city of Bethlehem and Northampton County and Lehigh County, and we can help people access them through our van. And we hope to have some of our community partners come in our van with us on some of our clinics and do outreach with us as well. So that is going to be a facilitator for us to increase health and social equity in our communities.
Wonderful. Well, we're so grateful you could join us today. This is an amazing start to the summer, and so thank you for all you're doing through the Health Bureau. We're really excited.
Thanks. We look forward to being out there.